There we are.
Oh, great.
Can you hear me okay?
I can, thank you. Hello, Chris. All right.
Just keep Chris muted.
What's that?
Keep him muted. He's fine.
Chris?
This should be fun.
It should be fun. We have,
Okay, that was amateur.
I'll wait just a bit here to see if Judge Jenkins and Dr. Huang are able to join us, but then we'll get moving regardless. They have everything we need. There is Judge Jenkins. I see him. He's all masked appropriately. Judge Jenkins, how are you, sir? All right. And I suspect Dr. Huang will be joining us here soon. So what I believe we're also going to be streaming live on Facebook if I've clicked everything appropriately. We have 30 people watching us right now, and as many as 100 all total will be watching as observers. So what I would like to do here is Dr. Huang. Hello, sir. And so what I'm going to go ahead and get underway. We have our full slate of folks here. Everyone, welcome. My name is Randall White. I have a small consulting group called Elatorre. As a volunteer, I serve as director of 24 Hour Dallas, a nonprofit organization. And on behalf of 24 Hour Dallas, I welcome you to this webinar today with Dallas County Judge Clay Jenkins and other special guests, as we focus on kind of the dual purpose of this happy hour. One is to find out what's ahead for restaurants, bars, other hospitality venues perhaps in Dallas County as we navigate through COVID economic recovery. And then also it's important, we believe, for the restaurant, the hotel, the hospitality industry to have a good working relationship with our local elected officials, since they are making decisions every day that affect us. And so this also helps us do that. I do want to introduce who's here, and I'll come to you last, David, so you can make some opening remarks as well. We have with us Dallas County Judge Clay Jenkins. I'll get a little fuller introduction of him in a bit. Dr. Philip Huang of the Dallas County Health and Human Services. Emily Knight, the CEO of the Texas Restaurant Association, David Denney, who is the current president of the Greater Dallas Restaurant Association, and Christopher Aslam, who's the president-elect. And with that, I'll toss it to you, David, for any kind of opening remarks you want to make on behalf of the Restaurant Association.
Thanks, Randall, and thank you so much for really facilitating this conversation tonight. We're really excited to have so many, not only the great panel together here this evening, but also to have so many people signed up to watch and inquiries about how to watch for people who were unavailable to make it live. So there's been a great interest because, gosh, I mean, as you know, the restaurant industry's been hit hard, and we just wouldn't be on this call without you putting this together. So we really appreciate it. And I love opening remarks. They're great because nobody has said anything dumb yet. So it's my favorite time. And so, am I supposed to introduce everybody beyond?
I just made the rounds. I just wanted to kind of welcome on behalf of the Restaurant Association.
For the Restaurant Association, the Greater Dallas Restaurant Association is thrilled to be a part of this conversation. We represent 9 counties around this region, and that encompasses a great many units of restaurants and food service, food and beverage of every scope, size, mom and pop, big chains, everything in between. And we just are really thrilled to have a seat at the table. Thank you so much.
Sure. All right. So here in general is the outline for everyone who's watching. We're going to begin with our Judge Jenkins and Dr. Huang to talk a little bit about where we are, what's next. And then we'll go to Dr. Knight with the Texas Restaurant Association, then to Dr. Denney again. We have many juris doctorates at the table. We'll then go to Chris Aslam, who, like me, is the only one who doesn't have a doctorate after our name. And then I'll wrap up a little bit. Then I'm going to allow an opportunity here for the panelists to ask questions of each other, because I would suspect perhaps that Emily has some questions she might want to ask of Dr. Huang, or vice versa, and then we'll throw open to general Q&A at the end. And with that, I would like to go ahead and begin, although I see Dr. Jenkins is frozen up a little. I mean, Judge Jenkins is here frozen up a little bit. Perhaps, Dr. Huang, maybe we can begin with you. If you want to unmute yourself, who you have with you, Dr. Huang, and then Judge Jenkins, you can join in at any point that we can get your video streaming. There you are. Judge Jenkins, either of you can unmute and talk to us. You're going to talk to us while you're driving, I can tell. Who we have here on the call with us are restaurateurs, bar owners, hospitality industry folks, arts and cultural people, other folks that are interested in the nighttime economy, we call it, all of those businesses that thrive at night and help bolster the local economy. All of these businesses took an arrow to the heart by COVID in ways that many other industries may not have. And so we're curious from your perspective, where are we now and what's next for these industries from your perspective, either Judge Jenkins or Dr. Huang? Who wants to begin? Dr. Huang? Did I give you
I was going to let the judge start if he wants, but
yeah. It looks like he's getting to a place where he can talk. He's driving, so.
okay. I mean, I'll start a little bit. I think that we all want to get things opened up as quickly as we can, but from our standpoint, we just we deal with the health aspects and trying to address the public health concerns. And so, the judge has convened, like we have this public health sort of group with infectious disease experts, epidemiology experts, public health, to, come up with recommendations because, some of the current status is, and opening up is set by the governor's orders. And so we have our guidance document for the general public because there's still questions. People don't know, and the judge has always been saying just because you can doesn't mean you should. So we have our guidance out there just based on where we think we are in the current, state of our community spread of infection, what we recommend. Now, again, and so that's what that, and so there's the red, orange, yellow, green sort of status bars that, I think things are opening up. We want to get there, but based on what we're seeing, we have concerns because, all of the guidance, everyone was saying we really need to get things into a state where things are, improving for 14 days and we hadn't seen it. But we share the, interest and concern about, opening these things up. We want to, again, I want to see us get to green and, orange, yellow, green as soon as we can also. It's just, we're just monitoring some of these indicators because the fact is all the sacrifice that everyone has made a huge difference for the community. Whether, and it's, it's sometimes hard to measure that, especially things that you prevented. But, looking at how things did play out in different countries and communities and things, it absolutely could have been a whole lot worse. But that's what we're trying to, we appreciate working with you all. How do we make this better? And because I think there are things that make it easier to open up. And what we've been encouraged about as we're looking at the data, that as things have opened up, it hasn't, some of the hospitalizations haven't exponentially increased so far. They haven't decreased, but they haven't. And so that makes us think there are a whole lot of people who are still doing the physical distancing and wearing the cloth facial coverings and washing their hands better. And these things that I think are important. And so it shows us there is a path forward to opening up things in a safe way if people will be vigilant with that, and that will allow both to perhaps be done safely.
Sure. All right, and I'll come to you in a minute, Judge Jenkins, if you're in a position to be able to talk to us. I should have mentioned that Dr. Huang grew up here in Dallas, got his MD at UT, is that correct?
Southwestern.
Yeah. And then went to get your Master of Public Health with a specialty in epidemiology from Harvard. Very impressive credentials. We're glad to have you here and not have you down in Austin. You're a big asset to the county. Judge Jenkins, are you in a position to be able to kind of talk to us a little bit about where we are and where we want to go next for this industry? You'll need to unmute yourself. There we go. Now if we can get you unmuted.
There we go. There we go. Yeah, and I apologize. I got stuck in a meeting, so I'm driving, but I'm near home, and so when I get there, I can sit down on the computer and see you all better. Well, you know, as far as where we are, the governor has said what is legal. I think it's likely that no matter what happens, he'll continue to add capacity to restaurants and bars on a relatively, you know, steady basis. So I think what you can expect is, you know, to be at 75 and 100% before long. You know, what we're focusing on in the county is also advising people what's safe as determined by the Public Health Committee. And the Public Health Committee are not people that I selected. They're people that were selected by virtue of the fact that they're the chief of epidemiology at UT Southwestern, or the chief of infectious disease at the Baylor Hospital System, or the head of the DFW Hospital Association, or president of the Dallas County Medical Society, some hospital CEOs. But the health community as a group recognizes those folks as their leaders on epidemics of infectious disease. And so I've got to take my cues from them. I made peace early on that the best way to get our economy moving again is to do what the doctors tell us, you know, similar to the best way to, you know, beat a disease is to follow the doctor's advice. So, and I'm very cognizant that we're in a consumer economy and it's tough. You know, I'm not feeling it to the extent that you are, but I'm a 112 owner in Dos Mesas, used to be Mr. Macero, and own other, you know, restaurant holdings as well. And so, you know, I know it's not my sole job or my chief source of income, but I know we're feeling that. It sucks. But remember, in a consumer-driven economy, the last thing we want is for us to be able to get out there and do the things we want to do. Believe me, I would love to sit down and have a real happy hour with you. You know, you may not want to have a happy hour right now, but I'd love to sit down and have a margarita with some people and just, you know, pretend this wasn't happening, or God, you know, please God, it's over. But the last thing we want is for people right now, what they're saying is this sucks and I'm ready to go get out there and eat my favorite food and have a couple of cocktails. What we don't want them to say is this sucks. I was able to eat my favorite food and have a couple of cocktails for a week or two, and now it's worse and I don't feel comfortable doing that, because that changes that consumer confidence, you know, self-story for those folks from it sucks, but it's going to get better, to it sucks and it got a little better, then it got worse. I don't know if it's ever going to get better. That's when we really begin to bleed as companies, is when we get that double whammy to consumer confidence. So, you know, we're all trying to just thread that needle of getting things open as quickly as we can, getting people out there as safely as we can. And I'm sure we're not doing it perfectly, right? I mean, no question. Yeah, we're doing the best we can, but it's a novel new virus, and we're learning things all the time. You know, for instance, we heard in March that masks were useless and a waste of your time. And we heard in April, everybody needs to wear a mask to protect their neighbor. And we heard in May, hey, you know what, these masks, but they don't protect you. And in May we heard, hey, you know what, the masks protect you too a little bit. Now we're hearing, oh, the masks protect you a lot. If everybody will wear a mask, could probably get this over with. And, you know, who knows what we'll hear in July, but it is new, and so people are learning as they go. Just follow it. If the doctors tell me something new tomorrow, that'll be where I'm at.
All right. Well, I tell you what, I think we'd all like to sit down and have a margarita with you, Judge Jenkins. I should have, in the process of introducing you, came out of Judge Jenkins is a lawyer by trade, came out of Baylor University, was elected, I think, about 10 years ago to the position of judge of Dallas County. And people go, "Are you in a courtroom?" And the comment I've heard him say often, that I often tell people, is that the judge is like the mayor of the county. It is not a courtroom position. It is a chief operating director for the county. And with the focus that the county has on health as a primary service it provides to its citizens, that's where you get Dr. Huang and Mr. Jenkins focus often for us. So you gave a perfect segue to not sure yet what the governor is going to do. I think next I'm going to turn to Emily Knight, the executive director and CEO, president and CEO of the Texas Restaurant Association. She's had the benefit of actually working very closely with Governor Abbott and helping encourage him to reframe some issues for the industry as we've opened. So you can give us an update, Emily, kind of where we are, what's next, what can we expect?
Yeah, and Randall, if it's okay, I just want to take a step back, I think, as Judge Jenkins said, and really just sort of maybe level set for people the size and scope of our sector. Because I think when you understand that, and you understand not only there's the business side of this, but there's also the employee side, which is critically important as we try to recover, obviously, across the state. And so if we just go back to the beginning of the year when no one could have imagined that 2020 was going to be like this, we did about $70 billion in sales in Texas last year. We contributed just under $5 billion in sales tax revenue to the state, so huge economic driver across every county. We employ just over 1.3 million people, second in the state, and had about 50,000 units. And so we had this massive footprint, and really it was a bit of a heyday, right, for our sector. And I don't think anyone, maybe early January, there was a sense something was coming, but I don't think anyone could have imagined this. And literally overnight, these restaurants were forced to close. And I have to say, I think it's really important to realize that they did it in a very positive way. You know, in the name of public health, really, they eliminated in some cases 100% of their revenue or 70% of their revenue and had to convert their business models overnight. That's not easy to do when you have fresh product, employees, you have guests that still need to get fed. And it was very clear early on that we were going to have massive supply chain issues because we were 51% of the food dollar in Texas. So if you think about that and you close that outlet, even if you have restaurants that are operating at 30% drive-through capacity or curbside, you can't feed everyone. And that's really where the partnership with Governor Abbott started, was how do we make sure people are fed, we keep people safe? And so we did a number of things like the curbside alcohol to go, which has become very popular. We did retail bulk waivers for the first time, so we could actually sell bulk items inside our restaurants. So instead of going out to 4 places to maybe find chicken or eggs, you could actually get it at your local restaurant. And that was really important in parts of downtown Dallas, as one example. We then had our restaurants get a waiver with Governor Abbott to be able to actually put their food into grocery stores. And so you saw these new partnerships forming. And then we began the recovery process. And I think what we did is, and I agree completely with Dr. Wang, which is it's really balancing the science, the medicine, and the data with the need to recover. And so I've unfortunately sometimes had to carry the message back to our members, having met with our liaisons in Governor Abbott's office and asked his medical team for a number of things, and the answer has been no, we're not ready to go to that %, or we need to have this social distancing, or yes, you have to have sanitizer in the front and the back. No, you can't have more than 6 people. And so we've been stepping through this very carefully, and I think there is no doubt, guys, that you cannot run a restaurant profitably at 50%. And because of the 6 feet of social distancing, you can't even get to 50% in a lot of our restaurants. And so as you think about that impact, you know, we currently still have about 700,000 employees out of work, furloughed or out of work, because we can't get them back to work at the capacity levels we're running. And so I think, you sort of see a number of things happening. You see some folks that are doing quite well with drive-through and delivery. our high-end restaurants are really struggling because of a lot of the capacity constraints. But if you talk to folks across the state, I think what you'll see is they're working really hard to keep their customers safe. This is what we do, right? We are tied to our health departments in a very specific way because we're constantly monitored. This is not a foodborne illness. Every time I get a chance to have the microphone, I want to remind people this is not a foodborne illness. And I think that's really important because for some reason, we really like to look at restaurants and we like to target restaurants. And yet, if you go down the street to half the businesses that are open, people are stepping on top of each other. So I think we are bringing people in and we're seating them and we're sanitizing that area. And I think to me, Randall, what's going to be most important is the investment in contact tracing. Let's really understand, we know it's jails, nursing homes, and we know packing plants because our meat prices have accelerated. But when we can find through contact tracing that there is a spike, we can really address it. And to me, that's going to be the critical factor is as quick as we can get that moving and we have a better sense of where this is starting, I think we can do a better job of managing it. And listen, let's be really clear, guys. If all of a sudden there's a massive spike in an area, we've already been told we can get scaled back. And that's just the reality because at the end of the day, we need to keep our employees and our customers safe.
That's terrific. Thank you, Emily. I should have mentioned also, Emily came up through the ranks of hospitality, has worked in public education for some time, and was just hired less than a year ago as the president and CEO of the Restaurant Association.
Lucky me.
Lucky you. So, but the right person to be managing this situation at this time for this industry. Thank you very much for that. I'm going to next turn to David Denney, the current president of the board of the Greater Dallas Restaurant Association. Judge Jenkins, I heard you mention on a call with, I sat in on with the Greater Hispanic Chamber that you were going to at some point a kind of assemble a group of folks, industry experts that can provide you counsel. David will be your guy. David is an attorney by trade, but his specialty is food and beverage. So you can connect on the attorney realm, but his expertise really is restaurant operations, everything to do with retail and beverage service, etc. David, what do you want to tell us?
Well, Randall, again, thanks so much for putting this together and having us all on. And the good thing is we all share a common goal. I mean, to some it's more important than others, but we really just want everybody to be safe and healthy. We want our restaurants and bars to be able and willing to serve their guests and keep their employees healthy. And that has posed a lot of really interesting challenges. And there are second and third order effects to COVID that no one could have predicted. And like Emily said, we couldn't have known it was coming. In fact, we had our board meeting for the TRA in February, and it was literally a footnote. There was just this thing going on in another part of the country, barely, and in other parts of the world that, we were going to keep an eye on. And by 3 weeks later, it was here and restaurants were dark, and it was lightning fast. And so there has been a great deal of upheaval, but the Greater Dallas Restaurant Association has, we're tasked with sort of being the local arm of the TRA. And so we implement a lot of the TRA policies. So we have been working with the Restaurant Survival Plan, the Recovery Plan. And we have these resources, these amazing resources available for our local restaurateurs and bar owners. And bar owners, man, they're hurting so badly because they didn't even have a choice about to go or
right.
There was no choice. It was just darkness and prayer. And now as they're beginning to, just on the very front end of their recovery and their struggle, they have lots of questions about how to get open. And so beyond things that are coming from the federal government, we're trying to be a resource to answer those questions, to liaise with the city, to liaise with the county, to help navigate some of those questions about what are my opportunities to, how do I find plexiglass dividers? Nobody knew those. 1 month ago, nobody knew that they needed those. And so we're navigating this together, but the Restaurant Association at the state and at the local level are just working really hard to get out in front of those questions before they get asked, so that we can put things like this together to be a source of information, a source of comfort, a source of, I mean, I've listened to so much venting in the last 10 weeks, just because people need to be heard. And it's still a very scary time. And I've been accused of being overly optimistic this entire time. And I'm still very optimistic that our recovery is going to be a good and a strong one. But it has to be done intelligently and with a focus on public health. Because employees don't want to come back and work for an employer who doesn't take health seriously. And guests certainly don't want to go back to a food and beverage establishment that doesn't take health seriously. And restaurateurs don't want to be saddled with the title of a business owner that doesn't take public health seriously. And when you juxtapose that with the need to make money, it puts a real strain on that small business and many large businesses too. And so it has been a challenge. I feel like we have really risen to that challenge and will continue to do so in our public-private partnership with the association. It's a very scary time, but it is a very exciting time that has led to some amazing innovations, not only in the philanthropic and nonprofit sector with things like DFW Eats and the Dinner Bell Foundation and Furlough Kitchen and all of these amazing projects to take care of people in a safe way, but also we've seen restaurant and bar owners innovate with meal kits to go and buckets of pre-mixed margarita mix and all kinds of wonderful
No buckets, David.
No, with a bottle of liquor.
There we go.
For sure. The bucket of mix. Believe me.
We don't need to stop there. I'm not having a margarita to go conversation.
I laid down on several beds of nails over that fight, but the innovation and the marketing and watching these guys do things they have never thought they were going to do before, not only to pivot to go, but to pivot into I'm gonna sell you a take-home meal kit, and then you can watch me on Instagram cook it with you. That's great, and that stuff's going to carry on long past COVID. That innovation is going to stay with us, and that is a real kernel of hope, and it's what the industry is made of. Man, it is made of just gumption, fight, resilience. It's always been like that, and it's going to continue to be like that. And the industry itself will survive, and it'll look different. And we need to work with Dr. Huang and Judge Jenkins to craft how that looks in the future. And that difference is probably going to be a good thing. And not everybody knows what that'll be like, and it'll be a little bit uncomfortable to navigate, but we're going to get it done. No question.
All right. Well, thanks, David. And of the 6 faces you see on the screen, one of us is an actual restaurateur. And that's the next person that's going to speak to you, Christopher Aslam. Chris Aslam is I think, the classic American success story. The kid out of high school goes into business with his dad, works with a restaurant, and next thing you know, he's the largest franchisee of a particular quick serve restaurant in Texas, and then expanding into Nevada. And Chris will be the next president of the board of the Greater Dallas Restaurant Association. Chris, what do you want to say to us?
Boy, I want to echo what David had said. I think we need to go into this with positive intent. All the elected officials, nobody asked for us to be in this. And I know a lot of our livelihoods are affected. I know our employees are scared and have gone through a roller coaster of emotions. And the overlying thought of that is just understand that everyone should be approaching this with positive intent. The elected officials, the restaurant owners, the employees when they're scared or they're needing something changed. And I think it's up to us to let our voices be heard and be in constant communication and letting our officials know what works, what doesn't, if you have good ideas, and they listen. The Restaurant Association has been an amazing advocate through these times to help our officials navigate the waters of this. In the beginning, there were some municipalities that thought closing restaurants was a good idea until they realized, and the association was able to point out that we represent almost half of the food consumption in Texas. So that would have caused even longer lines at the grocery stores and stuff. But as we go through this, there are things that the government can do. Some of the things would be like clear and unbiased enforcement of new ordinances, and also understanding that sometimes there's lead times. If we're going to do plexiglass or masks for the employees, it does take some time to source some of those within a week or two. So I think understanding that and being able to get on board with it and comply for the good of everyone is absolutely the right call. And it's a two-way street that both of us are going to have to walk on. Also, you know, there's things like the inspectors, the code enforcement, anyone from the government that does come in and help the businesses. A lot of the restaurant owners are mom and pop. They don't have access to the latest news sometimes, or are not up to date with the ever-changing flow of what's going on. So education goes a long ways for us to really help each other and get through this together. Some of the other things that I know that are being worked on, permit expediting, you know, coming up with really creative ways to do parklets or get restaurants reopened should they require inspections or other items that require the government there. And then, you know, one of the last things is financially. I think so many folks are hurting right now, and it's really, really so sad to see. And, you know, whether it's from the COVID or people, restaurateurs were affected by some of the civil unrest. I think Dallas and the surrounding counties have shown an unprecedented will to work together. I had the pleasure of traveling around to 12 different states in the month of May on business. And I got to see a whole range of how other states and counties and governments are dealing with COVID. And I'm very proud of Dallas and our officials that are on this. I thought it was really incredible to see some of the decisions that were made quickly, and you guys were able to go and be willing to have conversations about stuff that worked and didn't work. So that was really important. And then the last thing is continuing anything that helps our employees. These employees are already living paycheck to paycheck. The fear level, the anxiety with them having to watch their children at home without being out of school, without having school, wondering, are they going to be able to pay their rent? There's been some really great associations and the Texas Restaurant Relief Fund, and just different things the city have done that have really helped. So I think all of that comes back to the statement in the beginning is keep it positive and understand that things are going to change and that things are going to change quickly. And if we work at this together, we'll do really well.
Thanks, Chris. I do want to put a couple plugs in. You can see some people are kind of posting some chat questions. If you want to respond to them individually, you're welcome to, or hold off and we'll do some Q&A here at the end. I do want to put in a plug for those of you that are in the restaurant industry, perhaps not members of the Texas Restaurant Association or the Greater Dallas Restaurant Association. I'm sure Emily would be happy for you to visit txrestaurant.org. And there you'll find a plethora of resources for restaurants who are managing. Right now, the Restaurant Association is treating every restaurant and every bar as if they are a member of the organization. They're advocating for you, whether you're invested in them or not. However, the time will come around here quickly, specifically as we get into the legislative cycle in Austin, where I think you'll want to be a part of the Texas Restaurant Association, if I can put that commercial in there, completely unsolicited. And then your involvement with the Texas Restaurant Association also puts you at the table with the Greater Dallas Restaurant Association. So last I want to talk just a little bit about 24-Hour Dallas, the other partner in this enterprise. 24-Hour Dallas actually sprang up out of the Greater Dallas Restaurant Association. In full disclosure, the Restaurant Association is a client, but this project I'm working on as a volunteer. We are a coalition of cultural organizations, hotels, restaurants, festival people, social service agencies, restaurants, of course, food trucks. We're all working on the nighttime economy. That part of our city that begins with they call it the other half of the day, that part, that other 9 to 5. And we're focused on how we expand and grow and strengthen the nighttime economy of Dallas because it adds to the quality of life here. We were just getting our feet underneath us, and then boom, COVID. Then boom, social unrest, all based upon the murder of George Floyd. So now we find ourselves stepping back a bit and saying, how can we lead the voice in recovery from both of these situations? So I encourage you also to go to 24hourdallas.org, find out more about our all-volunteer organization. Many of our leaders and members are watching this webinar as well. But our focus really is on safety, economic vibrancy, cultural innovation, economic data, inclusion, respect, and communication, because we have found through some of the things that we're doing that we're not communicating very well. And it's no fault of the structure of our governments. You know, you have something coming out at the federal level, something coming out at the state level, something coming out at the county level, something coming out at the city level. There's been no one place to go, what am I supposed to be doing now? So with that on, I have been asked to chair a City of Dallas committee that's consulting and providing counsel to our city council on the restaurant, arts, cultural, hotel, hospitality, tourism. And we have a different group there that's making recommendations for things the city can do. One of those things that's coming up are parklets and expanding into the public space, because we need space in order to keep the healthy distance. And these are things that cities around the world are doing. We're very connected with about 50 other cities around the world that are expanding into the public realm for restaurants and bars and spaces like that, even retail. So please come to 24hourdallas.org. I'd love to have you involved there. Right now, it costs nothing, but find out what we're about and how you can be a part of that. So the very first thing I wanted to do here, though, is ask, do any of you, the panelists, have questions of any of the other panelists? Or Judge Jenkins, is there anything else specifically after you've heard what we've had to say here that you or Dr. Huang might want to be able to contribute? Questions among each other? Maybe?
No, you know, I learned by listening. I appreciate what y'all had to say, and we do want to work with you. If there are ways that we can help you in procurement, you know, as like the City of Dallas and the county orders our own plexiglass, if people want to talk to our purchasing agents about joining in on that with the strength, we're buying a lot of it, obviously.
Yeah.
And mask and hand sanitizer, etc. So, you know, there may be ways to work there. And one thing, Randall, on, you know, I do want to work with David and everyone here. When we had talked about that large business group and getting those subsections of business, this was at a time when it appeared that the county would make the decisions on opening, at what percentage, at what time. Now, we're still communicating, but the reason you hadn't seen, you know, Mark Cuban and John Stevens and those folks that are sitting on that business committee and the Irving Chamber and the Black Chamber, Hispanic Chamber, reaching out and grabbing somebody from each industry,
right,
is because that's happening at the state level. And we're more focused in the Economic Recovery Task Force in businesses that want to, you know, help in the areas of testing, tracing, and you know, things of that nature. Not that we don't still care very much about having a good opening, but we've ceded what is legal and the timeline of that to the state government. And we're focused with the doctors on how best for people, if somebody says, hey, I want to go to a movie, what's the safest way to do it? Is it, you know, does it matter if I'm over 65 or recovering from cancers? Is that a factor? Those are the things that we're mostly focused on in those business communities now.
Well, as somebody who's over 65 and recovering from cancer, I appreciate that, Judge Jenkins. I do want to say, too, the City of Dallas has some funding available to small businesses. It's focused on, they got an allotment of federal funds specifically being used in the City of Dallas. The county also did receive an allotment of funds that they're distributing to those cities in Dallas County that are not the City of Dallas. And I guess they go to the county website to learn more about that. You've got a lot of COVID resources, both on Dr. Huang and the general page. Is that correct, Judge Jenkins?
That's right. We just got the vendor hired last Tuesday for the small business fund. So if you did not get PPP, you're eligible for up to $15,000 from the county. It's somewhat similar to PPP in that you've got to keep your employees, 75% of your employees retained and being paid, and you got to stay open. I believe it's for 4 months. So it's not a lot of money, but it may help some very small businesses. And then for your employees who are having trouble making ends meet, if a person makes 80% of the adjusted gross income average for the Dallas area, they're eligible for up to $1,500 a month in either mortgage assistance, rental assistance, or utility, a combination utility assistance. Both of those programs are on a lottery because there won't be enough for everyone that needs it. It's, you know, such an acute financial crisis. One thing that's not on a lottery, if your employees send their kids to a daycare, again, this is outside the city of Dallas, although there's a mirror program inside the city for everything I'm telling you about. If your employees send their kids to a daycare, that daycare is eligible for a $3,000, I can't remember if we call it a loan or a grant, but all they have to do is just stay open for a month and keep the money. So basically every daycare is going to get $3,000 if they just ask for it. So we have that. We're also looking, I don't know, this probably doesn't help restaurants as much as it helps other businesses, but we're working with the city of Dallas, the school district, the community college district on a big broadband initiative so that we would take in mobile broadband into places like Pleasant Grove, where a lot of clerical workers that need to be working from home or tech support, what have you, can't go into the big room anymore. Particularly if we, if in the winter we see a second, problem. And we'd have that in place. They'd have their hotspot, but we'd have the internet going so that you'd have, even you might have 5G in a neighborhood that now, is really bad. And that may be better than what you can get in the Park Cities during this project. And that's a short-term project. It's a CARES project. I don't know how it would continue going next year, but that's another thing we're looking to do.
I'm going to go to a question here that was answered. It was asked by one of the people watching, and this is probably directed to Dr. Huang. Do you envision the virus spiking again this summer enough to need to close down or move back on some of our closures? Based upon what
we really don't know. We hope not. I think I mentioned earlier, a lot of it depends on everyone still being vigilant and trying to do the preventive things that they can. And if people are, what's been reassuring to us is things have opened up, that the numbers haven't really spiked up, although we're still following it, because there's a lot of different things that are going on that might cause the numbers to go up. And there's some recent, reports from the hospitals. They're seeing more numbers in our daily counts have sort of been going up. But thus far, again, we haven't seen that exponential increase. And we really think it's because there's a whole lot of people who are still being vigilant and doing teleworking and washing their hands and staying 6 feet apart and wearing cloth facial coverings. Because, even though the streets are more crowded than they were a couple weeks ago, they're not as bad as they were 4 months ago, certainly. And so there's still, that is keeping things down, but it's going to keep, it's going to require people continuing to do that. But we don't know, there's so many unknowns about this. And that's what we just hope everyone will do everything they can so that some of these things that really might help opening up will be allowed to progress, and because again, we want to see us move down to orange and yellow and green as much as anyone. Yeah,
the orange, yellow, and green is in reference to a color code chart that the county came up with. You'll also see that at the county's website, Dallas County website. If you visit that, you'll see we're kind of in red, which is the biggest alarm category. A follow-up question also kind of tied to that last one, Dr. Huang and Judge Jenkins. Compared to other states with similar case numbers, our death numbers are on the lower side. Do we have any idea why that is?
I'll say one thing, just that I know that Parkland was participating in some of the early trials for remdesivir, the medication that's been shown to be somewhat helpful. Their actual mortality rates in Parkland were doing much better than many other hospitals around the country. So that's one thing in terms of, we've got great care and institutions here, but that is one thing specifically I do know about Parkland and participation in some of those clinical trials, that their numbers are actually doing better than a lot of other places.
All right, here's another question for our restaurateur friends. A couple of questions here. One has to do with supply chain. Now that we're getting back into business, ramping back into business, some of the suppliers for various products are increasing prices, passing along their losses to their restaurants. And so the restaurants then are put in the position of having to up their prices. And it just seems like we're going to kind of create a hyperinflation. What can be done about that? What's the thought about that now? Maybe Emily, is that something you can respond to? And maybe David, I don't know.
Yeah, and then I'll let Chris, because I'm sure Chris has a good eye on ordering too. And I think where we saw the real crisis as we reopened was on the protein side. So, we had, and people really felt that it was, we didn't, and I say this simply, right, there weren't enough animals and all. We actually had a lot of COVID in our packing plants in some of our key areas here. I have the good fortune of being in a CEO group with all the different state restaurant CEOs. And I think you made the comment that every state has sort of done things a little differently. But most of, I think 10 or 12 have taken our promise documents, right, which is sort of that commitment document. And so as you think about what happened is, as those plants went down across Iowa and Arkansas, Nebraska, Texas, and they went to reduce capacities, we actually had a supply chain really breaking point in those packing plants. And so we saw overnight, in some cases, beef go up 40%. Well, a restaurant that's making a 9% margin, a barbecue restaurant that's just reopened, has now lost all their margin and more. And so I think that there's two things right now that we're telling restaurants. One is you need to use dynamic pricing. I was raised in New England. There was always any seafood, it was market price, and you knew you couldn't have it, right? That was the rule in the family, because if it had market price, it was expensive. But it was really a way to fluctuate with what was coming in and out. So we're seeing a lot of restaurants go to market pricing so they can actually ride the dynamic out. We really don't love a COVID charge. That really seems very punitive to just say there's a COVID charge. I think we need to have a better transparency with our guests. We're asking restaurants in a lot of cases to move their menu, right? So if you're a restaurant that has 17 pages of a menu, you're probably gonna have to scale that down now because that supply chain has to get moving again. And then also it's looking at what you are serving in general, where we have some of these spikes. It's hard for me to believe that our broadliners are just simply passing on costs, because that relationship between the broadliner and the restaurant is so important. And they've really been here for us in the crisis and moved a lot of product that we don't normally order into our restaurants. So we could essentially be grocery stores. And so to me, I really want to keep that relationship with the broadliner and the restaurant and have that dialogue. I get daily, believe it or not, the pricing sheets, and which is kind of interesting, and it shows the flow of a lot of the pricing. And I think it will stabilize. I think we're looking at this July-August timeframe where we'll start to see some stabilization in the supply chain, which is good news. Right now, it's just a little rough because the whole country's starting to open. And so you have a lot of pent-up demand that still has to get through the channel.
Right. Chris or David, anything you have to add to that? Chris.
Yeah, I can speak to it a little bit. What a lot of the big chains are doing are they're moving their offerings. So for instance, ham has been a really tough thing to get. So if the restaurants they have something on the menu that's special, they're shifting over to products that are more available, and they're doing it rather rapidly to make up for it. The other thing that we've realized was the supply chain is somewhat different from the grocery store supply chain. And even on the large chain side, it became clear how important the individual independent restaurants were. Because when the independents started to go down and they couldn't open their dining rooms and stuff, it caused a huge infrastructure backlog problem for the distribution centers. So they weren't able to make they didn't have enough routes to make sense anymore financially and stuff. So there's things that you can do also. You can talk to your delivery company and also ask, hey, what if I go to one less delivery a week or every other week or some other frequency that can reduce some of the pressure on them. Also, be willing to take substitutions. Ask, sometimes just the simple fact of asking, they're not going to tell you, but they might say, well, hey, we have a great deal on chicken this week. And you can do something with that. So just being creative and always asking questions is going to be really, really important, because there's lots of opportunities there if you can navigate through it.
Here is a non-restaurant question from former Dallas City Council member Ed Oakley. We have one of the largest dance clubs in Dallas. We're at a loss at how to follow the rules in place and protect our customers and employees. I guess there's some clarification not coming out of the state about that. I connect daily with the nighttime advocates from around the world, nighttime economy advocates. I saw some videos posted yesterday from a club in Berlin, honest to God, chairs spaced 6 feet apart, and all the dance club people were sitting in their own chair, dancing in their chair. Is that where we're going to be, or how are we going to move forward in the realm of clubs and dancing? What's the—
Yeah, Randall, I'll take that. So, and I'll only take it because we, as you know, we have had members from the bar community for quite a while, but we never really represented the bar community. And when the bars weren't opening, and we had the ability to still earn revenue, although we couldn't really make a profit, the bars had nothing. And so we were asked by a number of folks to step in. We formed a coalition of what I would call really, and Judge Jenkins will like this, I think, but really bar owners that want to be responsible and wanted to reopen and wanted to have their businesses return. And we put the bar promise together, worked with the medical team from the National Restaurant Association, and then submitted a plan, which then got them to 25%. But in there also, as we went to 50%, there is very clear guidelines about this is bars, clubs, nightclubs, and Randall, it sounds crazy, but there's not specifics on dancing. That does not say there's no dancing. But the idea of a lot of people together dancing on a dance floor, I think makes a lot of people nervous. And this is where I will say to you, I never knew our role as the TRA would be advisors in the way we are having to serve. So we get these protocols, we get them usually a little ahead of time, and we are aware of them because we helped, give advice of what may work and may not work. And then we just, as you know, we do a webinar and hundreds of people jump on right away, and we tell them, this means this, you have to do this. If you don't do it, you're going to get us closed again. Same thing for the bars now. And so there are clear protocols. And what I would strongly suggest is, and I'm not sure the gentleman you said who asked, we're happy to sit on the phone or Zoom and walk through what the best way is to be safely and to meet those protocols. And so we spend, our whole team right now across the state, we spend countless hours each day just helping our operators. And I would say to our elected officials, please send people our way, because we're finding that if you see a problem and you can get them to us, we can help clarify and also make sure they understand what the protocols are. And I can tell you, they all want to do this safely. They just don't know what the rules are. And so we're happy to sort that out for them. And in this case, I'm happy to talk to this gentleman and help you make sure that dance clubs, there are capacity limits, there are things you have to do inside, but you certainly can be operating nowhere near the level, but we can get you back open.
And kind of following up on that, it comes back to Judge Jenkins. Somebody says, did I just understand you to say that the governor is responsible for setting some of these standards right now rather than the county and the city? Is that true?
So the governor will tell you what is legal, and the county will listen to the local doctors to tell you what is safe. And I think most people want to do what is safe. And so you can go to dallascountycovid.org and you can download the color-coded chart there. And everything the governor opens, like if the governor's saying We can have day camps for our kids in the summer. And so if you're like, hey, is that a good idea here in DFW? The doctors have weighed in. You own a day camp and they didn't say what you like, you know, I understand that disconnect. But again, they're not looking at it from anything other than giving their best medical advice based on the situation on the ground, the medical models that the hospitals work on, you know, every day. And so that you can find that. We'll keep doing that. I'm committed to getting you the current information on what's safe. And the governor, though, has passed orders to say he'll tell you what's legal.
Okay. Okay. That's
Do
a
we
good
think though,
clarification.
but I would just wonder, Jenkins, I just have to jump in there real quick because knowing how much I've asked for our industry and how much I was told no because of the 4 medical panel doctors that he uses, everything goes to them first. And I was even in dialogues last week where I was on a call as some of the discussion with some of the strike force was happening. So I just want to make sure we don't mislead people that he's just making economic rules and not safety, because if that was the case, I'd have a lot more capacity right now based on what I've asked for. But I feel like they also have a medical team at the state level that is advising. It may not be the same, which is why we have individual counties, but I don't want it to get lost that somehow there isn't medical or a team of medical doctors and specialists that are advising at the state level too.
Definitely. There's a team of doctors advising at the state level. What I would suggest when you're deciding who to listen to, and no disrespect to any group of doctors, you know, the doctors that look at pandemics are epidemiologists. And so at the CDC, it's saying the same thing, by the way, that Dallas County is saying, which also is saying the same thing that every other urban area's epidemiologists, infectious disease, and public health doctors are saying. So the 3 specialists that deal with epidemics of infectious disease that broadly affect the public health are public health experts like Dr. Huang. There are, you know, chiefs of epidemiology and infectious disease. That's who we have here locally and who they have at the CDC and the local people that are saying the same thing in Houston or wherever. So that's who I personally will be listening to in deciding what's safe for my family. No disrespect to these other specialties, you know, different backgrounds that are, you know, the governor knows that he's asked for advice from.
Okay, I just realized I've been mispronouncing your last name wrong, Dr. Huang. I apologize for that. You know, it was very confusing too early on. Judge Jenkins was one of the first to step out early on behalf of a county and begin to kind of approach this COVID crisis, the pandemic, from a health perspective, and really took a leadership role there that was recognized nationwide. And I will add one comment here. Somebody said, thank you for everything you've done for our city, our county, and our sanity. So that's appreciated by the folks on this call. I'll also like to say that there are things we don't know, like the dance clubs, and I will connect Emily, I will connect you with Mr. Unkley so that he can help kind of find out what are the rules right now. But there are also similar incidences going on right now that have to do with the arts. And, you know, events that are taking place outside have more latitude than those that are inside. And in general, around the globe, they're thinking theater is going to be about the last to come back online. And that new data now about choral concerts, and that when people sing, they spray, and what that's going to mean and what's going to have to happen there. But I have a lot of confidence in the arts community that they're going to find creative ways to work around this and still deliver their medium to a wide audience. I have a question here. When do you think disposable one-touch menus will no longer be needed? Who wants to grab that?
Well, I'll take that. I mean, you know, it's again when we start really having this under control. I mean, ideally, when we get to our green zone, we're saying that's sort of the new normal until we get a vaccine. And so probably that disposable menu, you know, I mean, we understand why, just that you reuse these surfaces and that contamination and people get it on their hands and then rub their eyes and things. So you know, I mean, it's a safer practice until we really have a real new normal, probably until we can have a vaccine. But, you know, I mean, I think that there are other cleaning surfaces that are important also. But again, it's hard to say, and it depends on how everything progresses and how fast we can really have the transmission under control and feel comfortable with everything that's going on.
Okay. Well, okay, go ahead, Chris, and then that'll be the last comment. You need to unmute yourself, Chris.
There we go. Just a question for Judge Jenkins. If there are some businesses that have unique circumstances where they kind of fall between two sections of business or some other, is there a process to get them a review to see if they could open?
Well, yes, again, that whether or not a business can open is with the state. Yeah, but if you contact my office, if you contact Clay with your business, clay.jenkins@dallascounty.org, then I'll reach out to the chief staff of the governor for you, and we can see about that. You know, I hope that helps. Do you want to elaborate on that?
Just for the general business community, I was asking.
Yeah, we have some businesses that do this and do that, and they don't fall in one category. Emily, go ahead and unmute yourself. You're going to need to unmute yourself. I'm sorry.
7,000 Zoom calls, and I still can't get it right.
Yeah.
You know, one of the things we're hearing a lot more now is about mental health. And it's just really been in the last 2 to 3 weeks where we're getting more inquiries from employers about their employees. You know, we've got more than 40% of our workforce at least out of work. And it feels like, you know, I'm in a home and I have to be confined, but those folks that are living in apartments or don't have green space, or it feels like, and maybe it's just my assessment from looking at all the phone calls that we're getting in. Is there a plan from either the state or obviously the county that we're thinking about how mental health will maybe be addressed? Because I just feel like it's a boiling pot at this point.
So anyone who needs help now, we're cutting out a little bit, sorry about that, but anyone who needs help now, if you go to dallascountycovid.org, all one word, and county is spelled out, dallascountycovid.org. There are links there. There's a link where they can click on to have a free conversation, kind of an online appointment about mental health. And then also there are links to subsidized or free mental health outlets for people. You know, and I think as employers, so I'm a first-time elected official, but a long-time employer, you know, it's so important that our employees know we have their back, that this is a time where they need to look to us for help and have that trust. And, you know, trust is one of those things that you can't bank it, right? It's not like you have $1 million worth of trust today, but you did something that made the employees not trust you, so now you only have 600,000. Either have it or you don't, right? And so this is a great time for us as employers to reach out, and just the simple thing of checking on people, setting up a buddy system, reminding people. I tell my cops every day at noon, the last thing I say is, you know, take care of yourself, show grace to yourself. You're showing grace to me, you're showing grace to each other, but you're making these life and death decisions. You're putting your life on the line out there. Show grace to yourself and practice self-care. We want our employees to know we appreciate them. We want them to practice self-care. If they don't know what that looks like, and you can kind of tell when they don't, then we just need to talk to them about what does that look like. I think, you know, that'll be something that they'll, you know, remember that you did for them for the rest of their lives.
Yeah, that's great.
Very, very wonderful final message. Thank you very much. Make sure you check out txrestaurant.org. 24hourdallas.org for other resources. Judge Jenkins, Dr. Huang, Emily, David Denney, Chris Aslam, thank you very much, and thank you all for watching. We'll upload this to YouTube and share it with the Restaurant Association as well as the 24 Hour Dallas. Thank you so much. Have a good day. Appreciate it.
Thank you.
Thank you.
Thanks, guys.